Chronic inflammation is one of the hidden reasons you cannot lose fat, and fasting is one of the most effective ways to reduce it. I'm Dr. John D'Ambrosio, chiropractor for 32 years, author of Fasting That Works. At 58, I lost 20 pounds of fat while maintaining muscle and reducing inflammation was a huge part of why fasting works so well. So, what is inflammation? Acute inflammation is normal and healthy. You cut your hand, it gets red and swollen. Your immune system, it's actually fighting infection and healing tissue. That's good inflammation. But chronic inflammation, totally different. It's low grade, constant inflammation throughout the body. It's linked to obesity, insulin resistance, heart disease, diabetes, and a whole list of metabolic problems. Chronic inflammation is often caused by poor diet, lack of sleep, stress, and constant eating. When you eat all day, especially processed foods and sugar, your body is constantly processing food and dealing with blood sugar spikes. Insulin stays high, oxidative stress increases, and inflammation builds up over time. Your immune system is always slightly activated, which actually drains energy and interferes with fat loss. Here's why inflammation blocks fat loss. Inflamed fat tissue doesn't respond well to insulin. It becomes more resistant. So insulin stays elevated, which blocks fat burning inflammation. Inflammation also disrupts hunger hormones. Leptin, the hormone that actually tells your brain you're full, stops working properly. You eat more because your brain thinks you're starving, even though you have plenty of stored fat, which you should be burning. Chronic inflammation keeps you hungry and keeps fat loss locked away. Fasting, it actually reduces inflammation in several ways. First, it lowers insulin. High insulin drives inflammation, so when insulin drops during fasting, inflammation drops too. Second, fasting triggers autophagy, which cleans out damaged cells and again reduces the inflammatory signals they produce. Third, fasting reduces oxidative stress by giving your digestive system a break and allowing your cells to focus on repair instead of constant food processing. There's also research showing fasting reduces inflammatory markers. We're getting a little technical now, like C reactive protein and interleukin 6. These are molecules that signal inflammation throughout the body. When you fast regularly, these markers drop, which means your body is less inflamed overall. You feel better, you recover faster, and guess what? Fat loss becomes easier. I noticed this personally. Before I started fasting, sometimes I'd wake up with joint pain, especially in my shoulder, usually my right or left shoulder, and I just assumed it was just age. But after a few weeks of consistent fasting, pain decreased significantly. My energy improved, my digestion improved. I realized a lot of what I thought was aging was actually chronic inflammation, and fasting was what reduced it. Fasting also improves gut health, which is directly tied to inflammation. When you eat constantly, especially processed food, what happens? Your gut doesn't have time to repair. The lining of your gut can become permeable, which allows toxins and bacteria to leak out into your bloodstream. This triggers an immune response and drives inflammation up. Fasting gives your gut time to heal, which reduces inflammation and improves overall health. Makes sense, right? Here's a practical takeaway. Chronic inflammation makes fat loss harder. It blocks insulin sensitivity, it disrupts hunger, it disrupts hormones, and it keeps fat locked away. Fasting reduces inflammation by lowering insulin, triggering autophagy, reducing oxidative stress, and healing your gut. Less inflammation, that means better insulin sensitivity, better fat burning, and much faster results. The longer you fast, the more anti inflammatory benefits you get. 16-hour fast reduces inflammation, 24-hour fast reduces it even more, but even consistent 16-hour fast done daily will lower inflammation markers over time and will improve your metabolic health. You don't need extreme fasting to benefit, just consistent fasting windows with low insulin. So, what's the bottom line? Chronic inflammation keeps you fat and it blocks fat loss. Fasting reduces inflammation by lowering insulin, triggering autophagy, and healing your gut. Less inflammation means easier fat loss and better health overall. There's a free cheat sheet in my bio. You can literally hit the link, download it today, and start losing fat tomorrow. It's that easy.